Good morning, everyone, and welcome to Healthy Start's fifth annual legislative breakfast. My name is Sherelle Fulton, and I am Healthy Start's consortium co-lead. I would like to welcome you to this important event. This year, we are dedicating this event to the life and loss of my co-lead, Latavia Michael, who was a mother of three, community health advocate, and friend to many. She loved the time she spent in the community, learning and sharing her gifts. I would like us to take a 10-second moment of silence in honor of her life. Thank you. I would also like to advise you that the views and opinions expressed during this event are solely the opinions of the individuals who will be joining us today, and they do not necessarily reflect the official stance, policies, or positions of Healthy Start Pittsburgh or its partners. The content shared today is for informational purposes only. Next, I will introduce Bernasia Young.
Thank you so much, Sherelle. I hope everyone is having a great morning. It is Friday. Hopefully everyone has their coffee, tea, water, whatever you are drinking. Today, I would like to introduce our opening speaker, the warm Allegheny County Executive, Sarah Innamorato, who since 2024 has been leading us on behalf of over 1.2 million Allegheny County residents. County Executive, the floor is yours.
Great. Thank you so much. And thank you to everyone in Healthy Start. You are an incredible partner to the county, and the work you do each and every day is changing people's lives. So we so appreciate it. I want to thank the folks from the state who are also on. I know Senator Acosta, Representative Frankel. We are all aligned in making sure that we can invest in Black women and Black families and decrease racial disparities that exist in our healthcare space. So, this is a team sport. It's going to take all of us, folks on the ground, people in elected office, to really put a dent in the data that we see before us. So I know today we're here specifically to confront the pressing issues around how mental health issues particularly affect Black mothers and families. And, this audience, you already know the statistics. They are glaring and they are quantifiable, and they're alarming. So Black babies in Allegheny County die before the age of 1 at a rate that's over 5 times that of white babies. Black women in Allegheny County are nearly twice the proportion of preterm births and twice the proportion of low birth weight babies compared to white women and birthing people. And the rates of postpartum depression and anxiety are higher among Black women. And I take this work personally, and I take this work on with a race conscious lens. We have to, if we want to close the gap in those disparities. The Allegheny County Department of Human Services, the Department of Health, there are incredible people who work there every day who are also committed to doing this work and making sure that we can leverage every state and federal dollar available to us so that we can get every single person the mental health resources that they need when they need it. And this has been something that we've taken on since day one. When I took office last year, we started off by saying, hey, let's connect with the community. Let's see what wisdom we can harness from our neighbors and from people who are actually living and breathing this work and experiencing what inequitable policies and funding have gotten us. So through the All In Allegheny initiative, which your leader, Jada, actually served in a key leadership position in that transition. we surveyed 19,000 people in Allegheny County, and from that feedback, we created an action plan. And I just kind of want to go over some high-level programs that we're working on because the community told us that's what they wanted this administration to work on. So we have mental health and postpartum units that operate 4 days a week and served more than 400 people in 2024. And I've tasked the health department with thinking through how they can leverage additional monies so that we can expand these mobile units and get people the care they need it where they need it. We are continuing to invest in our WIC mobile van, and we'll be posting our 2025 schedule soon. That's to get out into the community and get families signed up for WIC. We've been successful in the Best Baby Zone that ensures that babies who are born into communities are given the tools and resources, the families are given the tools and resources they need to thrive and really mitigate the risk factors for infant mortality. We're looking at opportunities to expand those into different areas. We also are looking at expanding our Behavioral Health Fellows program. That's a program that offers student loan assistance, competitive salary, and paid time off for training to attract new candidates to work in positions where people and families are waiting to get the help that they need. As a result of our first 6 cohorts, over 1,300 people received services that they wouldn't have because of the lack of staff in that space. And it gets better. The purpose of this program is to make sure that there are more behavioral health professionals that look like the people they're serving. So we did increase racial diversity when it comes to the folks who are participating in that program. So we have a lot of work to do in that space, but we are doing our part. We have the Hello Baby Network, which supports families with new babies and helps meet family needs by offering in-home visiting programs. And Allegheny County nurses meet new parents and their infants during their pregnancy and postpartum in the comfort of their own home. And that's a way to build trust and to provide services in a place where families feel the most comfortable, their home. We're also reducing our reliance on municipal police by launching alternative response, which we did late last year. So what that does is deploy behavioral health specialists when someone is having a mental health crisis, as opposed to police. So that is a joint effort between our 911 centers, municipal police forces, and alternative response. So finding out more ways to help people who are in crisis. And all of that is made possible by the funding that the county collects from the taxpayers. So at the end of last year, we had a little bit of a battle in getting our budget across the finish line, but it was important for us. And I want to thank anybody who is on this call who spoke out in favor of that budget, because it allowed us to maximize our drawdown dollars from the state and really fully fund Department of Human Services, which we know that money is critical. $1.3 billion comes from the Department of Human Services and out into our community. So it's an incredible amount of money, and we are better and able to invest in programs and systems that work because of that budget. But I do have to say that a lot of that is at risk right now at the federal government level. And there are threats that hang over each and every one of us every day as this administration signs new executive orders and freezes and unfreezes money. There's threats to cut Medicaid and other vital services. It's scary and uncertain times, and we're appalled at the chaos and the cruelty that we've seen coming out of this administration, and we know how devastating it would be. And so it's so important for us to continue to do our work, but to educate our neighbors and our elected officials on what these cuts would do and how they would harm our communities. Because if we're looking at cuts to Medicaid, you're talking about over 200,000 adults and 106 children who rely on Medicaid just in Allegheny County. Medicaid pays for 1 in 3 births. that happen in the state of Pennsylvania. It is almost the entire funding source for our behavioral health services. Nearly $500 million per year we get from the feds to fund our behavioral health program through the Department of Human Services. So we need to be bold, and we need to talk about, what is actually at stake as these orders come down from the federal government. But I do have to say that it doesn't change the mission of my administration and the mission of the people of Allegheny County. We are committed to serving everyone. We are committed to creating an Allegheny County for all. We are worried about these cuts, and the only way that we are going to stop them is if we organize and we use our collective voice to say, we will not stand for it. I know so many companies and nonprofits, they're feeling pressure to shy away from initiatives like DEI, but I'm not ceding any ground here in Allegheny County. I think we are better when we are diverse and we have more viewpoints at the table. I mean, why would we design programs to be exclusive? Inclusion is a core value of our region, and I will wear an equitable lens as we proceed to build programs and make critical investments. And I'm sure so many of you agree with that viewpoint. And I know we'll continue to do this work together because it's more important now more than ever. And I know that when we work together, we can continue to do big things and see the outcomes that we all deserve here in Allegheny County and beyond. So thank you for having me today.
Of course. Thank you for joining us. It's always a little bit of a shell shock to go after the county executive. How am I supposed to follow that up? We really appreciate you taking the time today to join us and provide that overview, because it's so important for our communities collectively to have an understanding of what exactly is going on in their, everyday world, and then also behind the scenes. So we appreciate it. With that, I will continue the conversation around what policy and advocacy looks like, particularly for Healthy Starting, which, if you do not know, is an almost 35-year-old community-based organization situated in Homewood, where for many, many years we have specialized in improving the lives and well-being of Black moms, babies, and families across the county. Much of our work extends beyond the county into both state as well as national efforts. And one of the most notable efforts that we have is through our Allegheny County Battling Inequities and Realizing Transformational Health Outcomes Plan, or BIRTH Plan for short. This BIRTH Plan is a collaborative effort within community, county administrative offices, community-based organizations, healthcare providers, you name it. Anybody who has and needs a seat at the table is part of the Allegheny County BIRTH Plan. And within the BIRTH Plan, we focus on two primary areas specifically related to this call, this educational webinar today, which are strengthening systems of care as well as strengthening workforce, because we know that both of these areas relate specifically to mental health concerns in the Black community. And the BIRTH Plan predates any policy efforts that we have here at Healthy Starting, which you will see moving forward that there is quite a bit of synergy between the two. So as I mentioned, our policy platform, which if you have not seen it before, is a three-pronged approach right now that focuses specifically on healthcare justice, workplace justice, and reproductive justice. So for folks listening at home, what does that look like operationally? Healthcare justice, for example, is a win in PA House Bill 1618, which passed last session or last year, which provided coverage for doula support under healthcare insurance in the state of PA and established a doula advisory board to further standardize certification. What this means is that if you're somebody who seeks birthing assistance via doula, they will have coverage, which means it'll be a little bit easier for you to find a doula who's willing and able to assist in your birthing experience. In terms of our workplace justice bucket, I don't know if many of us know this, but the Paid Family Medical Leave Act is the closest it has been since being introduced over 5 years ago. And the Paid Family Medical Leave Act will ensure that families who have young ones, who are dealing with, parents who may need a little bit more assistance, are able to take the time they need from work to be able to care for their families without the fear of losing their jobs. And we are extremely close to having this passed at the state level, which means the work that we do is extremely, extremely important, and your support in everything that we do is necessary. And then finally, the third bucket for reproductive justice. If you are somebody who is into documentaries, if you're a little bit more of a movie buff, we highly encourage you to go see The Ebony Canal, which features our input from our CEO at Healthy Start, Jada Sherrill, and it showcases the integral expertise of Healthy Start and our support for Black women having the right to raise a healthy family. All of these buckets showcase where we are with our policy and advocacy work at Healthy Starting. And we continue to do this work not only alongside legislative officials, policymakers, folks like County Executive Sarah Morato, but also alongside our community members. These can include our community health advocates, which, if you are also not familiar, are Black moms in the Allegheny County area who undergo an intensive 8-week training to learn how to better advocate for public health policy as well as themselves, and then also be able to translate between community and Healthy Starting to ensure that we always have a community-centered lens in anything that we do. So with that said, I know that was a lot, but that is just the groundwork for why we are here today for the 5th Annual Legislative Breakfast. And again, we want to thank County Executive Sarah Morato so much for her expertise, insight, and support. Next up is Mr. Art Terry, our fatherhood coordinator at Healthy Starting, a member of the National Healthy Start Association Fatherhood Practitioner Planning Team, a chairman for the Fathers Collaborative Council of Western PA, and our introductory speaker for Dr. Paula Poe for this morning. Mr. Art, the floor is yours.
Thank you, Renasia. On behalf of Healthy Start, it's my pleasure to introduce to you Dr. Paula Marie Poe. Dr. Poe is a board-certified child and adolescent psychiatrist and an assistant professor of psychiatry at the University of Pittsburgh. She earned her medical degree from Howard University in 2011, completed her psychiatry residency at Montefiore Medical Center in the Bronx, New York, and her child psychiatry fellowship at the Yale Child Center Study in New Haven, Connecticut. Dr. Poe's community-based participatory research focuses on the use of human-centered design techniques and collaborative team science to develop interventions that improve the mental health outcomes of Black children by engaging Black fathers in early childhood participatory research. Thank you. Dr. Poe.
Good morning, everyone. Thank you so much, Art, for that introduction. And I thank you all for the opportunity to speak with you today. I am sharing my screen. Can everyone see? Good to go. Excellent. So I want to talk today about how Black fathers' mental health affects the family. I am, as Art said, a child and adolescent psychiatrist. I focus on infant mental health, so early childhood. And by the end of this talk, the hardest part of this talk is staying on time. So I'm going to time myself as well. But I want to identify some of the root causes of mental health issues that Black fathers face. I wanted to talk a little bit about the benefits of Black fathers and fathers in general, but Black fathers' positive engagement in early childhood in this perinatal period. And I'm also then just going to describe a community-based participatory research project that I'm engaged in with some of the individuals here on this in this meeting today that's going to meet the psychosocial needs of Black fathers and help them increase their capacity to be who they want to be for their children. And so, as it was stated earlier, the reason why there's an enhanced focus on Black children and Black families is because they experience inequitable adversity. These statistics are coming from 2021, which was the most recent time, but more than 1 in 5 Black children in 42 states and DC experience poverty. And that's notable because there are no states in the United States in which more than 20% of white children experience poverty. Another important fact is that mass incarceration, Black children are 7 times more likely to have a parent who is in jail as they're growing up. 45% of Black children go to schools that are considered to be failing schools. And essentially what that means is that they're not meeting the metrics for graduation rates for any, oftentimes it's reading and math scores. And 45% of Black children are growing up in unsafe neighborhoods. These could be neighborhoods that are significantly affected by violence, gang activity, drug trafficking, other environmental risks. And so all of this is notable because you can see how one thing affects the other, right? Oftentimes in unsafe neighborhoods, there are not a lot of dollars and tax dollars going into creating safe and highly effective schools. We know that individuals who don't receive high quality educations are more likely to be incarcerated. And we know that the incarceration specifically of Black males, Black fathers, increases the likelihood of poverty that Black children face. So these all build onto each other and are very significant. And so I wanted to just talk about the benefits of positively engaged fathers, because it's notable that father engagement improves things significantly and in different ways than mothers. So for instance, when we talk about language development, fathers have a tendency to speak with more complex language than mothers, as it's been studied in the research. And so children actually learn more complex skills. So essentially, mothers and fathers' interaction are complementary and different as far as children and their developmental skills. Social emotional development, a lot of times we talk about fathers engaging in rough and tumble play with kids. It actually is very helpful for helping kids learn how to manage their emotions, knowing when to stop, kind of knowing some limits. It's also notable that when fathers read to their young children, it improves their school readiness in a way that is different from mothers. Dads also help with healthy risk taking, encouraging children, pushing them in ways that, again, are going to be different from mothers, but allows them to test their limits, feel confident in their ability to do things, and take chances. Having engaged fathers also decreases childhood mental health problems. There were particular studies that looked at, again, dads reading with children in early years from 0 to 5, as well as just engaging in on the floor play with children. And they assessed these children when they were 9 years old and found that they had decreased mental health problems and issues later in life. Positively engaged dads also are protective for maternal mental health, particularly during the perinatal period when dads are engaged from the beginning. One, it is increases the likelihood of their further engagement. So if a dad is engaged at the very beginning, he's more likely to be engaged at later time points. Also, when dad is engaged in this perinatal period, moms are more likely to have first trimester prenatal care, as well as postpartum issues. When dad is engaged from the beginning, it is protective for mom's maternal health postpartum, as well as protective against any effects of postpartum depression, postpartum anxiety, any effects that could have on the infant. And lastly, fathers experience particular benefits just to themselves when they're engaged in their children's lives. That's not only psychological health and the positive feelings that they gain from being engaged in their kid's life, but also physical health effects. A lot of times being engaged gives a father purpose. It helps to focus his priorities, decreases some risk-taking behavior that might be going on, as well as has benefits for protective, preventative medicine issues. So just getting regular health care. Nevertheless, Black fathers are an untapped resource. And so I just wanted to give you a sense of some of the work that I've been doing. One study asked 101 Black fathers here in Allegheny County who had recently had a child. So the criteria was that they had to have a child who was 0 to 2 years old, so recently engaged in the obstetrics setting. We talked to them about their experiences during that time. And so 90% of these fathers were present at the first and or some of the follow-up obstetric appointments. So that's meaningful because it is a point of entry where we have access to these dads, right? Overall, and I want to say 30% of the fathers were actually at all of the OB appointments. Nevertheless, what stood out was that only 1/3 of them, actually 1/3 of them, said sometimes, rarely, or never did they feel valued at those appointments. And so we asked them, why didn't you feel valued if that was the case for you? 25% of them said that the OB provider didn't ask them any questions, and 10% said that the OB provider ignored them blatantly. And so that's just one study. But Black fathers are also untapped oftentimes in the promotion of mental health of young children. And a lot of times we see this with early childhood prevention and intervention programs. I want to applaud Healthy Start because you have been engaging fathers almost since the inception of your program, but most times this is not the case. And so when we're talking about how we can promote the health of young children and the mental health of young children, it's all related to the caregiver-child relationship, having a nurturing and supporting relationship that is very responsive to the needs of the child, otherwise known as like improving relational health, right? The capacity to develop these nurturing relationships. Very often, fathers are not included in these services, and or fathers don't necessarily know that they can be included in these services because they often are geared towards mom. Obviously, they were developed with mom in mind, right? Mom and baby programs. And so dads often don't know. Oftentimes, care workers, might not engage dad because he seems like he's uninterested. But I feel like it's a missed opportunity that we should focus more on and try to rectify. And again, just talking about social emotional development and some of the things that kind of get in the way of Black fathers being utilized to the best of their capacity, we often see maternal gatekeeping in situations, let's say, for instance, where mother and father's relationship went sour and they're no longer romantically involved. Oftentimes, you can see where situations where mom, for whatever reason, could be an issue of child support, could be an issue of, I'm just disappointed that the relationship didn't go as well as expected, and or I don't think he's a positive influence for the baby, right? But you can see situations where mom is keeping the baby and keeping access to the baby away from that dad, and that's important because one of the things that we want to highlight is that even when mom and dad are not together, there's a very important role that dad can play in the life of that child. And if, for instance, a mother thinks that a father is a negative influence, then we, as the community of service workers and healthcare workers, need to be doing what we can to make sure that that dad has the capacity, has the skills and the resources necessary to be who he wants to be for his child. And lastly, I just want to say oftentimes, similar to the first study that I mentioned, healthcare providers, as well as other service providers, can gatekeep, whether it's consciously or unconsciously, just because we oftentimes have bias when it comes to father roles. And this has historically just been the case as the fatherhood role has evolved. Our thinking and our expectations have not necessarily evolved to see dad as a caregiver, to see dad as wanting to be involved. And so that's also just important to highlight. I also did a preliminary study just kind of asking dads about early adversity and toxic stress, which, as I mentioned earlier, disproportionately affects Black children. And what came out of that was the understanding of the unique stressors that Black fathers face. And so we know that there are inequities when it comes to the distribution of power, education, income, and incarceration, right? So Black fathers face this racism and discrimination disproportionately. And similar to that graphic that I showed in the beginning, they very often were raised in similar situations. And so these essentially, these power dynamics that they have no control over are going to hinder their ability to be the provider that they want to be, to the protector in often cases that they want to be. And so this creates what's called fatherhood role strain. And so role strain is when the role that you have, fatherhood, and this role of protector, provider, is being strained by oftentimes outside forces outside of your control. And so because Black fathers really value the ability to provide and protect their family, but for instance, might not be able to get the job because of a previous incarceration and or when they get the job, they're not being paid as much as their counterparts. This is going to be a significant threat to masculine identity. And so oftentimes the way that people compensate for this threat is with what we call hegemonic masculinity. And hegemonic masculinity is this idea, this cultural idea that masculinity needs to be dominant over femininity or over anything that resembles femininity. And so oftentimes this results in displays of aggression, displays of dominance, which also includes emotional suppression, right? So it's this ideal of manhood that that essentially legitimizes dominance. And so when it comes to this level of emotional suppression, as you can imagine, this is not conducive to the nurturing, supportive, responsive relationship that we talked about being necessary for children to thrive, right? The other thing to note is that the effects of emotional suppression for the Black fathers themselves causes psychological distress, right? There's this inability to admit that you're not perfect, that you're not feeling amazing, that you are vulnerable, right? You can't be vulnerable. So it creates this distress. It also creates loneliness, right? Because there is no one that you can share your genuine feelings with oftentimes. Subsequently, you can have issues of social isolation, as well as anxiety and depression. And so levels of anxiety and depression are actually not known when it comes to Black men. The best estimates are about 5 to 10% of Black men experience anxiety and depression, which as a provider, I think is woefully underreported. It's underdiagnosed. There's a significant stigma. And again, that goes back to these ideals of masculine dominance. It's not oftentimes culturally acceptable to have depression. And what happens is, even when depression is diagnosed in Black men, it is actually harder to treat. And part of the reason I think for that is because by the time depression meets criteria, right, or if a Black father's symptoms meet criteria for depression based on our current scales, it's actually significantly more severe than it is in individuals of other races. And so, again, kind of being in the situation where there's cultural stigma against these mental health issues, oftentimes we can see intimate partner violence as a result. We can see harsh and dysfunctional parenting when there's this level of psychological distress and not an opportunity to have an outlet to deal with it. And so turning the page, oftentimes Black fathers are talked about in this deficit way, but I'd like to move from deficits to these possibilities, because social connectedness is actually found to buffer all types of negative effects of stress. It's also widely protective to health, and it can even protect against the negative effects of discrimination and trauma. And so when we talk about social connectedness, we're talking about a sense of belonging, having those who you can connect with, and knowing that there are individuals who have your back. So the idea of increasing social connectedness could be particularly helpful for Black fathers. There's also this idea of parental self-efficacy. So that's the idea of having a sense of competence and the belief that you can successfully perform the tasks and overcome the challenges associated with parenting. Oftentimes, there are no, like as I mentioned earlier, there are no preparatory classes or services for fathers to learn how to be fathers, to gain that competence and or that confidence to do so. High parental self-efficacy can actually moderate even paternal depression. So again, when a dad believes he can perform in his fatherhood role in the way that he desires to, it actually can moderate any effect that depressive symptoms could have on the effect of his child. And so I just want to finish by letting you know about a community-based project that I'm doing with my community advisory board. So it is all informed by Black fathers and women who love Black men and Black fathers. And so the goal is to create a Black father peer mentorship program where advocates and mentors have lived experience. We're going to create a safe space for Black fathers to receive validation, to be able to develop a brotherhood of accountability, with this understanding that doing this together will decrease the stigma of these connections. The goal is to build this program on the strengths that these Black men already possess, as well as to provide tangible resources, whether that be support in court for custody issues, whether that be letting you know where you can find job opportunities, etc. And I just wanted to give you a hint of kind of where we're going with this. These are just the 4 modules that are going to be discussed during this peer mentorship group: the power and purpose of fatherhood, ages and stages of child development, co-parenting and conflict resolution, and life skills. And so that's just a little preview of what our group is doing. So in summary, fathers provide unique benefits to child development, and very often they want to be much more involved than they are. The transition of fatherhood is an optimal time to engage fathers. There's even hormonal and brain changes that happen during this time that open men up to receiving parenting information and just more support during this time. It's very important that we address our conscious and unconscious biases that we have against fathers. Black fathers are often untapped resource for improving the Black maternal health crisis, as well as the outcomes of young children. And lastly, there is a need for innovative and culturally tailored efforts to engage and retain fathers in programs that support them in early childhood as well as in the lives of their kids. Thank you so much for listening.
Hello, my name is Annette Jackson, and I have the privilege of introducing our first testimonial speaker, Mr. Thomas Washington, a parent and the director of the UPMC Neighborhood Community Center located in the East Liberty area. Mr. Washington.
I'm sorry, trying to get myself off of mute. Thank you, Dr. Poe. Thank you, Healthy Start, for allowing me to give a little bit of insight around my journey wrapped around mental health. But Dr. Poe hit upon a lot of areas which really affect men, especially Black men. Being a Black male in the community, working in the community for over 11 years in nonprofits, working with families, working with fathers, understanding that mental health is definitely a journey. And if not tapped into or understood, you could go on a spiral downhill. So just wanted to talk a little bit about my mental health journey. So in 2019, I started with my mental health, seeing a therapist and really not really understanding, wrapped around like a lot of the stigma, but I knew I needed some assistance and help just for my day-to-day stressors. In 2023 is when my family core was shooken. Within 6 months, I had lost both of my parents, lost a close friend and mentor, and lost a child, all in the same year. Those things really led to for me, especially my two sons, and them understanding and seeing the traumas, the things that were going on within my life, and how to really help them understand like what's going on and how to handle these things. So got assistance from like going out to the caring place and initially having those feelings wrapped around grief. But I felt that there was a deeper need for therapy around trauma and grief. So I reached out to my own employment assistance program. If you have that, please utilize that. That was one of a great helps for me due to the fact that I can choose and see what therapists would work best for us. So I utilize them on a one-on-one basis, as well as group sessions with my sons. I believe the therapy actually saved my life and enhanced my son's perspective wrapped around therapy. For them to understand that it's not really taboo to sit down and talk about your problems with a professional. And it's important for me, for my children, to see the resiliency and the proper steps to healing. So in my opinion, healing involves the willingness to accept where you are at that time. And sometimes it's hard to accept that you aren't in the best state of mind, state physically, mentally, even spiritually, that you're not really in the right mind. And really realizing that can be a struggle. I know day to day I struggle. The healing process and throughout depression and stress and grief and trauma, all of those things brought up in one can really lead to hard times in your personal and your work life. So really understand your mental rejuvenation. What do you need wrapped around that? Your therapy and physical outlets. If you got a hobby, those help with the healing process. I'm truly blessed to have a great supportive circle. When all this was happening with myself and my family, one of my mentors said to me, when it becomes silent, you will need that support the most, right? And you'll need that supportive circle. Really didn't understand what he meant by that until it got silent. So, you know, everyone's around when things are when things are happening initially, but what about 6 months or a year from now, where you're really going through that process, and it does get silent? Those individuals who are closest to you, or the support system and support cast that you have around you, is very important. And it's also good to say I'm not okay today, right? Letting people know that I'm not feeling well, letting your friends, family, and you know, your children know, like, I'm not really feeling that great today. My oldest son, when I was telling him, like, hey, I'm not feeling good today, he would ask me, how you feel today? I said, I'm not feeling well. He said, is there anything I could do to help? I was like, that's a good question. I'll get back to you. But those things are always needed, right? Those things help you in your healing process. So if anyone on the line is going through any type of mental health issues, situations, problems, it's great to go see a therapist or any other mental resource. Don't hesitate to seek assistance. And it's not taboo. It's not, as a Black male, it's not something that you should definitely not take lightly. Like, if you need help, you should go get it. And the strength is in your journey. I think that I've had over these last 2 years or so, I've had a really intense journey. But the journey has definitely led to great outcomes for my family, great outcomes for my sons. And then, you know, I continue with the journey day to day. I thank you for allowing me to give you a few minutes of myself, and thank you.
The fact that I just keep having to follow up with these testimonials and these amazing speakers is, you know, really something over here. I do want to thank Thomas Washington, Dr. Paula Poe, and County Executive Sarah Namorato again for their time and their voices, their ability to educate on this call today. We will now move into our very first panel of the morning, which is our legislator panel. We have quite a few folks on today's panel, so I will give them a very quick intro because you should know which districts they are from, who they are representing. So first up, we have Representative Lindsay Powell of District 21, Representative Dan Frankel of District 23, Representative Arvin Venkat of District 30, Representative Abigail Salisbury of District 34, Representative Benjamin Sanchez of District 153, and Senator Jay Costa of District 43. Good morning to you all. I hope you are all well on this beautiful, bright, sunny Friday over here in Pittsburgh. I will kick it off with the first question to Representative Lindsay Powell, which is, what policies do you think are necessary to improve, which policies do you think are necessary to improve access to culturally competent mental health services for Black mothers, particularly in rural or underserved areas? Representative Powell, the floor is yours.
Wonderful. Thank you so much. Good morning, everyone. Hopefully I'm coming through clearly. I want to thank all of you so much for the opportunity to address this critical issue. It is imperative as a legislature that we are thinking intentionally about how to ensure that all folks, in particular Black and Brown women, have the ability to navigate our world with support, with resources, and with care. To your question specifically, there are so many things that we could be doing. Something that you mentioned early on in the call that I'm incredibly proud of as one of the prime sponsors of the bill is to ensure that we have family paid leave, just to kind of double down on how imperatively important it is to for birthing people, for people taking care of a sick family member, for truly anyone that has responsibilities outside of their work, that for our small businesses and businesses that don't have this resource already, that we're able to provide this. We, as we were working on this bill, heard horrific stories of women having C-sections and being forced to get back to work 2 days later, against the advisement of their doctors, against the advisement of their own bodies. Their bodies are telling them, you've done this miraculous, life-changing thing, and yet you've got to get back to work because your rent and your bills and everything else takes precedent over the health and safety and well-being of your own body. And so working on pieces of legislation like that center our need to address humanity and the recognition that, particularly for Black and Brown women and Black and Brown folks, that we are not always afforded these luxuries is imperative. And so I won't monopolize the time, but I know my colleagues will add their perspectives. But there's so much that we could be doing to protect Black women and girls across the Commonwealth. And I'm grateful for the colleagues on this call who are doing that critical and life-saving work.
Thank you so much for your response. Are there any additional comments or considerations from the remaining legislative panel regarding what policies you think are necessary to improve access to culturally competent mental health services for Black moms?
Well, this is Representative Frankel. I said, we've had actually made some significant progress this year, Bernasia, and I think as you noted earlier, in your opening remarks, we passed and signed into law Medicaid coverage for doulas, which I think are incredibly important supports for the care team for pregnant and postpartum individuals, which are particularly vulnerable with respect to issues, mental health issues. And we also passed a piece of legislation, also signed into law this past session, that provided legislation to create postpartum depression awareness. The governor has since made this a key part of his agenda. And a lot of this has come through a group that was established last session in the legislature, the Black Women's Maternal Health Caucus. Have initiated it, and the leaders of that caucus have really set forth the agenda that included those pieces of legislation, and there are others in the pipeline as well. It's led by Representative Gina Curry, Representative Morgan Cephas, and Pittsburgh's own Latasha Mays, and included a piece of legislation that she was able to get passed that provided for coverage for blood pressure monitors for individuals. So we've made some progress here, but we live in obviously a very fraught moment where, while we're trying to make progress here in Pennsylvania, and we have, and we intend to keep moving forward with the Black Maternal Health Caucus to address these issues, what we see in Washington creates a very uncertain environment with respect to existing supports through Medicaid, through SNAP, through Social Security disability, support for our FQHCs in our communities that provide so much health care, including behavioral health care for our most vulnerable people. So we're living in a very, very difficult environment while we're trying to move forward at the state level, trying to plug in the potential holes and challenges that we see coming out of Washington. Make this really difficult for state government to be able to respond. We passed legislation this past week in the House
we got a legislative
to make sure that we maintain
you have the right link.
the Affordable Care.
I was on this whole morning.
Is there somebody speaking there? It's affordable coverage, the coverage
Really?
protections that were provided under Affordable Care Act. So, as we make progress in Harrisburg on some of these specific issues, trying to make sure that we're going to be able to respond to what's coming out of the uncertainty that's coming out of Washington, I think is incredibly important. And I'm proud to work with all of these as chair of the health committee, along with Ben Sanchez and Representative Arvin Venkat and other of my colleagues who are on this call today. I think we're, working hard to be able to, make sure we protect what we've got and move forward and make progress on some of these other issues that we have a good record of this past session, and look forward to doing more this session. Thank you.
Thank you both so much for your insight, again, around what may be necessary to improve access to mental health services. Moving on to question number 2, and this one is for Representative Venkat. How do you envision partnering with healthcare providers, social workers, and community-based organizations to create a more holistic approach to Black mental health? Rep. Venkat?
So thank you for the question, and thank you for having me on the panel. For those who may not know, in addition to being a state legislator, I'm an emergency physician. And so the question is particularly relevant because it is something that I live in my clinical environment every day in terms of working with social workers, in terms of working with other stakeholders to try and better the health of patients. I think what we recognize out of the pandemic as an object lesson, but also in our day-to-day efforts to improve the health of Black women, especially when it comes to pregnancy outcomes, is that this goes well beyond the 4 walls of the clinic or the emergency department or the hospital, that it very much is directly related to how are we addressing social determinants of health. So whether it's housing, whether it's mental health access, whether it's good jobs, whether it's safe neighborhoods. And that's certainly one of the reasons why I decided to enter the political arena, because on behalf of my patients and my community, I felt like we needed to do more. So none of this is easy. And I agree with Chair Frankel that one of the major threats that is there is the threat to Medicaid, because we've been able to innovate with Medicaid to address some of these social determinants of health beyond simple reimbursement of healthcare. And if these draconian cuts go through at the federal level, then all of that progress will go away. And in fact, we will go backwards. And so I think this is a critical situation that we need to address through advocacy, that Medicaid needs to be confirmed in its levels of funding, and if anything, expanded, that we need to be advocating that the health and well-being of our community is directly at risk if we do not, find a way to continue Medicaid funding where it is. And at the state level, I'm confident with my colleagues on this call and with those across the aisle that we will be able to make progress. But frankly, the dollars need to be there in order to kind of move the needle on these collaborations that you're asking about.
Thank you for your expertise and your input there. Moving on to question 3, Representative Salisbury, if you are in the building, in what ways can state policies encourage mental health awareness and empower Black moms, families, and communities to take an active role in their own mental health advocacy?
Honestly, I think, oh, sorry, you told me to turn my phone landscape and I didn't listen. Honestly, I think that we don't have mental health care at any level that is acceptable. I mean, when we talk about mental health care for birthing people, for people who are either perinatal, postnatal, anything, we also have to address the fact that we just don't have mental health care in our country. We don't have mental health care for the veteran with schizophrenia who lives down the street from me, who just told me that her group therapy was cut and she has no group to go to anymore because of federal funding cuts for the VA. We don't have anywhere to send children. So long before they've grown up to get to the age of having children, they may already have accumulated terrible trauma that they've never had an opportunity to address because we don't provide mental health care at any stage of life in this country that is really acceptable. Even if you have a great job with great benefits, and I don't believe benefits should be tied to employment, but even if you have that, there might be a wait of months and months and months before you're even able to see anyone because the system is so overloaded. So I think that really we have to talk about the fact that by the time you are in a situation of needing mental health care surrounding a pregnancy, you might have accumulated decades of mental health trauma and unaddressed, perhaps even mental illness and things that have happened to you that you've never been able to process. I talk to women who say that giving birth has given rise to memories of sexual abuse that they suffered as children, that they never had an opportunity to process because they've never had mental health care. So I think that we really need to address this as a whole situation, that we are failing. We are failing broadly as a society, and asking people to take charge of their own health care is one thing, mental health or physical health, but I think it's a little too easy to tell people, oh, you need to take charge of your own mental health care when we've failed them since they were born. I don't know if that's answering the question you asked, but it's just, to me, sickening, the failure that we have for mental health care in this society. So
I don't think you spoke a word that wasn't true in that answer, and we appreciate the insight that you have from a legislative perspective. Thank you. So for our final question, this is a double header for Representative Ben Sanchez and Senator Jay Costa. What concrete actions or bills have you introduced or supported to address the mental health crisis in Black communities?
Thanks, Renasia, and thank you all for having me on the panel. And I feel like I am maybe the lone person from the southeastern part of the state. I'm out of Montgomery County, but it is great to see you all and to hear about all the great work you're doing. Work that I was aware of, but great to be reinforced, and definitely a fascinating program so far. And going later among my colleagues, they've obviously covered much ground on some of the questions. So apologies if I'm blending some of the questions here. But I wanted to highlight a few of the non-legislative actions that I feel are kind of important to the conversation here and of mental health. And it's one of the areas where some concrete steps I've taken along with my spouse who works in this space extensively in child advocacy, is making sure that child clients that are, for lack of a better word, in the system are accessing all of the mental health resources that they can within that system, and and really having that opportunity for early intervention if possible at all. And I'll certainly agree with Representative Salisbury too. That's a space where we can do much better, providing better resources, but at least accessing what is out there is so important, and raising awareness on those fronts that people need that, which I also try to do in another non-legislative space, which is my work with a healthcare organization out here in the East, Jefferson Health, in trying to definitely, espouse all these themes as much as possible, that mental health care is health care, and we need to do a better job of treating it exactly like that. And also working on, as Dr. Venkat mentioned, equalizing these social determinants of health, if that's the right way to phrase it, to, people should not be having different outcomes based on the zip code that they live in. And especially, when zip codes in the areas we live in are often just, less than a few miles apart. So definitely raising awareness within those two non-legislative areas, but also in the legislature. And I know several have mentioned it so far, the coalescing of several caucuses that are bringing these issues up to raising them up so that we all know about them. The Black Maternal Health Caucus has been mentioned, the Women's Health Caucus. We have several mental health focused caucuses, and we just need to keep having that conversation and driving it all the time because, as someone else mentioned, one of the keys here is the funding and funding all of these initiatives so that we have an adequate supply of providers and that we can pay those providers so that they're encouraged and able to work in this space is truly a key. So I'll leave a little more for Senator Costa because I know he's he's batting cleanup here, so he'll probably have some things he wants to add. And again, I thank you all for the opportunity to be here and to learn with you all and drive this. So thanks so much.
Thank you, Representative Sanchez, and thank everyone for participating today and allowing me the opportunity to weigh in on some of the concrete legislative initiatives that we have been discussing over the course of the past couple of years. I'd be remiss, though, if I didn't start to talk a little bit about where we're at with respect to things that have been accomplished the last 2 years. It's directly related to the legislative majority that Democrats have in Harrisburg. And prior to that time, these measures were never able to move. So I do want to applaud the caucuses that have come together, the Women's Health Caucus, the Maternal Health Caucus, and so many others that have been working together to create a litany of bills that need to be considered and passed through the legislature that we did see last year. And I applaud Chairman Frankel and all the members of his committee in the caucus for advancing a lot of these measures, some of which have gone on to the governor's desk, as was mentioned, but others that languish in the Senate. And our job in the Senate is try to continue to create a narrative that allows our Republican colleagues in the Senate to want to advance these measures. We've been successful with a few of them, as were mentioned earlier. All the measures that we've talked about have been measures that our Senate Democratic Caucus has advanced, and the Senate has tried to advance in the Senate as well. But the House measures have come over, and we've supported them. Just about every single member, if not every member, has been supportive of the work that was being done by Representative Cephas, Representative Fiedler, particularly as it relates to some of the mental health issues around postpartum parents. I think at the end of the day, in the mental health space, the work that we've done and I've done relates to $100 million we were able to do a couple of years ago in the budget that drove that money into our schools. At the time we were coming out of COVID, a lot of our school districts were hurting in terms of the students' ability to have access to appropriate level of mental health care or even conversations to that end. We were able to make sure that happened, and that funding continues as we go forward. Some of the bills that came through, you already talked about the doula legislation and the advisory board. Those are very important as well, things that we measured, supported through the process. What I can say is, through COVID, I think one thing that we learned, unfortunately, was that the disparities that existed in delivery of healthcare in our region and a lot of our communities, our underserved communities, many of the folks in that community are already aware of that, but I think the rest of the Commonwealth and the rest of the country learned how stark those disparities were and steps that we needed to take to be able to address them. But those are just a couple of the measures that we've already supported already. I think the point that Representative Frankel raised with respect to our financial situation with regard to what could happen through the Medicaid program and other program cuts that are coming down the road are significant, and they're going to impact a variety of ways in which we provide health care to folks. Certainly, mental health and behavioral health activities are going to be a big part of that, and we need to take steps to be able to push back on those and let people know what the impact is going to be to our communities, more than just the fiscal impact or the economic impact, but the impact on real lives that we're talking about. I think, as somebody mentioned, the impact on the healthcare clinics along the lines, the federal healthcare clinics. That's going to be a significant impact on access to community-based healthcare that oftentimes people simply, that's the only place that they can go. So there are a number of things that we're going to continue to be able to do and try to continue to advance. My colleagues have introduced legislation, for example, in Medicaid covered blood pressure monitoring for pregnant and postpartum enrollees. That's going to be an important thing that we need to do. I've been working along with Representative Kincaid on trying to put back in place the policy we had in place with regard to Medicaid individuals, with regard to dental care and the nature of the dental care that is being provided, the services that are being provided. We got to revert back to 2012 when a number of the what you would consider to be simple dental procedures being covered are no longer covered and create a barrier for folks to good health. I'm a big believer that good dental health leads to good behavioral health and good physical health. And I think at the end of the day, we have to take steps along those lines. There are a number of those type of things that we will continue to work on. And we're going to try to collectively to get across the finish line. But I got to say, our biggest challenge is to make sure that we fight back and figure out what we're going to do when we experience a lot of these mental health cuts. They're going to come from what's going to happen in Medicaid. This Medicaid threat is real, and threats in other communities as well. Just think about what they're going to do in education. As we know right now, the amount of money, $5 billion, could potentially be stripped from the Commonwealth of Pennsylvania because of their dismantling the Department of Education. These are through the title programs that make their way to our school districts that help those students that may be struggling in the schools, maybe from low-income families, low-income communities. These are real threats. They're going to have a major impact on what we do going forward. And we got quite a few challenges, and we're going to need the support of folks like the folks on this phone when we make those conversations happen and we raise the awareness of what's happening, that we join collective forces to be able to articulate those messages going forward. So the things we talked about, we've been very supportive. They were concrete measures that we work on and continue to support. And we know we have others that are be coming from the health committee as we go forward along those lines. So I hope that answered the question along those lines, and look forward to answering other questions that we might have.
Well, I think if anybody who's watching back at home has learned anything today, it is to understand that our legislators are down to be transparent and keep things going whenever, they get rough, and also to make sure that everything that we need as a community is being covered. So I want to thank you all again. I want to thank this dynamic, exceptional panel of legislators for joining us again for the 5th annual legislative breakfast. And if you'd like to learn more about them, we will be sending out additional information for you to be able to find your legislators, contact them, and to continue advocating for the things that we know we need at the state, federal, and local levels. So with that, we will be moving into our second testimonial of the morning, which will be delivered to you from Ms. LaCal Pace. LaCal Pace is a mother of 3 boys, and she is currently our outreach and engagement specialist for our Hello Baby Priority Program. She's a previous participant for both Hello Baby and Healthy Start, and she will be joining you now. LaCal, the floor is yours.
Thank you, Renasia. Good morning, everyone. And that was an amazing panel discussion. So a little bit about me. I sounded pretty amazing what Renasia said. I was actually a participant formerly with Healthy Start, working with the community health workers. During the birth of my amazing second child, I've experienced what typical my family and friends were expressing was the baby blues. It's just this time for me, it was a little bit darker and I didn't know how to navigate that. I was currently at that time facing barriers from FAD and childcare, FAD and affordable supports therapy, transportation to get to things. So it definitely made me feel a little out the way. And then when I first got to someone who actually shared with me, hey, it's okay to go talk to someone, I had that theory in my head, like the movies. I'm going to sit on someone's chair. The doctor's writing notes. What can these notes be? In my mind and on the outside, I feel like a great mom, but mentally that wasn't there. So as I spoke, the community health worker that I had was very amazing. We completed an Ettenberg's test together, and it did show that I was currently struggling. So at that actual time, she then presented to me, Healthy Start is starting an amazing program called Moving Beyond Depression. And I was like, that's great. They were meeting me where I was. But then the con behind that was, a clinician is coming in my home. And again, that theory started to circle. What is this going to look like? Upon entering Moving Beyond Depression, it was a full, complete 16-week program that I myself and the clinician work with, from workbooks, exercises, and just having someone to talk to. And because I was being met in my space, my sessions, I will be bouncing the baby on my lap, folding clothes, and really getting back to my day to day. When I think back on Moving Beyond Depression and also being one of the first to complete the course, I couldn't believe the full 360 and fully addressing the postpartum depression that I was currently experiencing. Um, so it was kind of sad as the program came to an end, but it gave me a lot of hope to continue on and move forward with seeking therapy. Therapy wasn't as bad. I wasn't a bad person for having the many hats, being a mom, working, and being in a relationship. I was filling my cup going to therapy. And I feel like that huge step would have never came about if I was not in Moving Beyond Depression. So eliminating that really allowed me to continue on. And kind of why I'm here today, because moving forward, after having my Moving Beyond Depression experience, I wanted to continue to advocate and support my community and keep those conversations flowing. Because when I expressed it to family and friends, it was like, oh, it's baby blues, your hormones is imbalance, and it was just like, it's a little deeper than that. And I was thankful for the education that I've received through Moving Beyond Depression. So I honestly thank y'all for listening to me and hearing just my personal experiences and seeing how the amazing program of Moving Beyond Depression was successful for me, and also being here today. So with that being said, I'm proud to introduce Taylor Pinkston, my former Moving Beyond Depression program clinician, who counseled me during my time as a parent in Healthy Start. First off, before we move forward, Taylor, I want to say thank you so much for navigating and supporting me in my time when it was needed. So I will present to some and introduce to others Ms. Taylor Pinkston, the program manager in clinical practice and licensed social worker, as your moderator for the second panel this morning. Taylor.
Oh, LaCal, you got me emotional over here. Thank you so much for that. Such beautiful words, and your story is so inspiring. I'm just so grateful to be here and excited to moderate this amazing panelist of mental health professionals. For time purposes, our panelists today are Andre Scott, owner and lead therapist at Able Vision Counseling and Consulting; Kava Murray, LCSW, founder of Hope Deals Counseling and Consulting; Aki Jamal Duram, marriage and relationship coach; and one of my clinicians, Tamara Tyree, master of social work. She's a perinatal mental health clinician for Hello Baby Priority here at Healthy Start. I am so excited to be a part of this and to have each of you here. I'm used to being on panels, but not always moderating them. So I'm really, really grateful for this opportunity. And I just want to dive straight in with you all. And Kava, I'm going to start with you. I want to hear from you why it's essential for mental health providers to be culturally competent, trauma-informed, and strengths-based when working with Black individuals and their families.
Sure. Thank you and good morning. LaCal, again, you did a great job highlighting this wonderful woman, Taylor. Taylor, I'm going to say these things are important because therapy is not a cookie cutter. It's not one size fits all. Also, when a lot of the interventions and methods were developed, they did not have, Black and brown families or other minority groups in mind. So it's important to recognize, folks and their individuality, their differences. It's important to be strengths-based because our culture creates who we are. So being able to see someone for who they are and identify strengths and help them work on their strengths will ultimately lead to better outcomes in their mental health.
That's so important, that the thought around choosing to see people as individuals and create a treatment experience that fits their needs, and how important it is to consider where they come from, their culture is so important. Aki and Andre, I really, appreciated Thomas earlier talking about the Black men's mental health experience. And I want to hear from you all on how can mental health providers help and support Black individuals of all genders, and their families and communities to destigmatize mental health treatment. There's so much stigma that we see. And, I remember even growing up hearing like mental health is not for Black people. That's not a Black people thing. And so what are your thoughts? And Aki, we'll start with you.
Okay. Thank you, everyone. So far, I've been inspired and motivated by what's been shared. I think we need to normalize the conversation. And one of the ways I think we as practitioners go about doing that is being particularly careful and intentional with our own self-care and making sure we ourselves are, it's essentially starting with the man in the mirror and being the change we need to see. Because we have this training, because we have these degrees, because we have this background does not mean we are immune to the same things that befall our peers in the Black community. I have my own stressors. I have my own traumas. I have my own hurts and pains. And if I do not go and attend to those with the help of a counselor when necessary, then I myself run the risk of, I often say, bleeding on my own clients. So at the end of the day, I think making sure that we show up as our best healthy selves. And number two, normalizing the conversations around mental health, because not everything about mental health is about counseling and therapy. I know countless men and women in the Black community who participate in their own forms of self-care by building community, by taking vacations, or whatever it may be, whatever is your normal. When you normalize the conversation that you're doing that for your mental well-being, then you start to remove the stigma of mental health as an issue for African Americans.
Thank you for sharing that. Andre, do you have any thoughts to add?
I do. Thank you all for the opportunity to be a part of the panel. Very enlightened, very encouraged by the unity, one spirit, if you will, that's being shared on this call. I stand in agreement with Brother Aki, just normalizing certain concepts about self. We are not, like he mentioned, immune to these dynamics or allowing them professionally into the world as significantly as possible so they can know that we also are processing our own individual challenges. But stigma is related to taboo, if you will. So just really allowing the truth to be present without further traumatizing or creating a deeper sense of fear for the field, for the process, because like Kaval said, is initially these systems were originally created for us. So being honest with that there were experimental processes and control-based things that were involved in mental health and other, medical dynamics, so that we are not bypassing the actual struggles and the actual challenges that we went through. There are instances where I'm afraid of the system, but if I'm comfortable with this individual, then I can walk in this process and I can engage in this healing journey. So being as authentic and open and loving as possible when we enter these therapeutic or these healing spaces, so that our participants or constituents, if you will know that we understand that there is a real life hesitance and reservation to entering such fields and allowing them to progress accordingly.
Andre and Aki, you both brought so much insight to that question around the importance, and what I really took away was the advocacy and how essential that is. We as Black mental health professionals are a part of the Black community. And so our mental health matters just as much as those that we support and serve. And, in thinking about even outside of our clients that we meet with who have, whether they know what they're getting into or not, shown that they're ready for some sort of treatment. I want to ask Tamara and Kaval, about, in terms of your community, Black and brown folks that you connect with, and what would you say to those who are ready for support? How do they advocate for their mental health, and be an advocate in community to do, to share that with others as well?
I'll let Tamara go first.
Thank you. Thank you all. I'm so excited to be here and really excited to take some time with this question. I think that once someone, especially in my realm, Black and brown women, show up and say, I need help, I think it's first being like, I hear you, I see you, and I'm so glad you're here. I'm so proud of you for owning up to what is going on, because so many of the women I work with have spent many years being discouraged to care for themselves, to think about themselves, and to value themselves as they should. And so once someone has the desire to get help, then you can begin the steps of advocacy, because advocacy is it's not just, go scream from the rooftops, X, Y, and Z. It's about establishing strengths first and foremost. How can you advocate best? So that kind of goes back to even the first question of being strength-based. And so that's step one in advocacy is people being able to identify their strengths and use them in a way that is most meaningful to advocate for their mental health. I think it's also important to tell people why it's important to advocate, right? Your voice matters because there is someone who has been through the same thing, who is so terrified to speak up. And so your experience has the potential, when shared, to make a really lasting impact. And I think when you remind people of that, it hones into this like intrinsic desire to leave a legacy or to make a difference. And that is such an important part of advocacy, right? That's the purpose of advocacy, is to speak up and make a difference. And in terms of what advocacy does to strengthen the community and families, I think being an advocate, having your children see you be an advocate, sets a beautiful example. And our children are our future. They are the future of our community. And so if we pass down advocacy to them, they will pass it down to, all the following generations. So that's how I encourage my participants to advocate for themselves.
Thank you, Tamara. Kava?
I would say, in my experience, I have, especially lately, had a lot of friends and, associates reach out to me on social media asking, about therapy and who would I recommend and where can they go. And a lot of those conversations start with, asking them not to be too personal, but to think about what they need help with and how to put that into verbiage that's going to be heard. Advocating to me is really modeling and coaching folks. So I'm going to model, the language that you may need to use to be heard by, your PCP, if you want to start there, or an intake person who may answer the phone. So really just teaching folks how to, use language that's going to get them heard. I think doing that for, anybody in any situation that's looking to address their mental health not only gets them connected with what they needed, but it also starts to work on, destigmatizing what we have going on. I see a therapist, and I encourage people who do see a therapist to tell that to other people when they're starting to struggle. So many people think that it's just them and it's an isolating experience and nobody knows what they're going through. So I think just normalizing our experiences and that none of us are perfect and that we're all struggling at some point in time about something, is also a key tenet in being an advocate.
That's so powerful and so true. It's why I am so pro disclosure. I'm a Black woman, and I know that storytelling plays a major role in the type of support that we're comfortable with. Mm-hmm. And I believe that there's so much in relation to how we disclose our own experiences with mental health that really can help build rapport and help people to normalize. Like, because I have this degree or license does not discriminate me against being in a mental health or having mental health concerns. Like, mental health does not discriminate. And I think that is so important for us to advocate. It starts with us.
It starts with us. Aki and Kaval, can you talk about potential policy change here in Allegheny County, Pittsburgh, I mean, ultimately and beyond, that is needed to support equity, inclusion, and justice for Black individuals?
I was going to defer to Kaval, but if you would like me to go first, I will.
Yeah, absolutely,
Okay.
Aki.
No problem, no problem. I don't have specific legislative ideas in my mind, but what I will say is this. My intention in attending today was to maybe highlight what our county executive talked about with regards to our Health and Human Services Department looking to partner with our law enforcement, and how that might at present look like a failed attempt, but it was an attempt and we needed to acknowledge the attempt and how to do better. But then once I got online, I realized what I was seeing. I'm seeing legislators and lawmakers. I'm seeing healthcare providers and caregivers, and I'm not seeing law enforcement. They're not here. And I'm not saying that as a critique to anyone who put this together, nor am I saying that as a critique to law enforcement for not being here. On the contrary, this was very well put together, and I'm honored to be a part. But what that speaks to is relationship. There is a greater ease of relationship between the people who make and create laws and legislation and the people who serve through social enterprises and mental health and other wellness service provision, right? There's a natural way in which we seem to get along. And yet that same get along doesn't seem to carry over to those in law enforcement. That's, again, not a critique, simply an observation. At the end of the day, whether we're talking about the Fortune 500 companies who partner together, whether we're talking about nonprofits and social enterprises who determine that they'll come together to serve side by side. At the end of the day, those sorts of partnerships thrive when the relationships thrive, when there are people who genuinely shoulder to shoulder and enjoy the company and co-working with the other people. When the people come and are in unity, then the enterprise thrives and the partnership thrives. And at the end of the day, we can only create intimacy when we create closeness and proximity, and they're not here. And so that's just an idea, is the thought like, okay, let's invite them here to start to create intimacy, which then leads to vulnerability, which then opens us up to greater accountability.
You got me nodding my head. All right. Felt and received. Kaval.
Thank you. To add to that, when we did the run through, many of you on this call know my personality and my filter, and you guys encouraged me to tell the truth. I cannot speak specifically to any policies, but I can talk about my experience with Medicaid in our county. It took my private practice almost 3 years to be able to see those clients, to see those patients. I have 2 locations, and the second location has still not been approved. When the credentialing company that I worked with reached out to identify, what the barrier was to me being able to see these people and address their mental health, I never got any type of explanation. It was the questions were often not even acknowledged. I was asked to submit paperwork that I know I submitted 2, 3, 4, 5 times. I started that process in November of 2021. I was not allowed to see somebody with Medicaid until August 2024. The process was so daunting to me and so stressful. I started to count how many people called me weekly with Medicaid insurance, just in case somebody was saying it was an oversaturation issue or wasn't a need in my community, or that somebody wasn't looking for the services I was offering. I started to do my own work. So I don't know what policy or, legislative action needs to happen with that. I don't know. What I do know is that well over 100 people called my practice looking for treatment for themselves and for their families, and I was not able to provide them with services. I was able to take on a couple people pro bono, but I'm also running a business. So I was willing to, fall on the sword and not make any money to make sure that somebody had mental health care. So again, I don't know what these policies are. I don't know that, but I know it shouldn't have taken almost 3 years to be able to provide people with Medicaid quality mental health treatment.
Ooh, it's so disappointing. And
It
I
is.
know
I'm
that
getting
I can feel it, and full empath over here. It's so disappointing that Medicaid is not seen as a value the higher up we go.
No, it's not.
So
It's
I
not.
appreciate you for being transparent enough to share that, because these are the behind the scenes that we do not know, and how providers are trying to provide treatment and literally have these barriers and trying to make it happen just to help people.
Yes.
Just to
Yes.
help people. Because
And
mental
if I
health
could add,
matters.
and if
Please,
I could
no,
add
no, don't even
one more
apologize.
tidbit, just one more tidbit.
Yes.
As a Black woman that does mental health and owns a business, the perception towards my business was that I did not care about people who had that insurance because I couldn't accept it. So the perception was I only wanted to work with cash pay or people with commercial insurance. So it painted a picture of me that was not accurate, and that I was doing everything I was trying to do to make sure I was accessible to anybody who wanted mental health care.
If I could co-sign that, as a person who operates with a Christian-based organization, we were seen as not Christ-like because we couldn't take on those people in spite of our desire to.
In relation of time, because I can go all day. I have tons of questions for you all. And I hope you all connect with these amazing providers, because they have a voice and their voice matters. I want to end where everyone has the opportunity to share some successes. We talk about the disparities, the statistics, the things that are not going well often. And a lot of times there's a lot of vicarious trauma that comes from hearing so many of these things that we already know. But what I would like to do is just give you all an opportunity to share what successes in Black mental health have you seen in Allegheny County and beyond. And so, Andre, I would like to start with you, and then Tamara, and then Aki, and then Kabah.
Once again, just thank you all for this platform and this opportunity. This is so needed. We don't always get the opportunity to connect, so this is like amazing to me. Successes include things like this, us being able to speak to different departments, legislators, things of that nature, with our philosophy and our approach and our general skill set being put on display, if you will. I know Aki, I know Kaval. Hopefully I will get to know tomorrow a little bit more, but that's a part of our success. We are able to develop a fellowship, a therapeutic family, if you will, so that when one of us may or may not be able to provide that service, we can refer a person to a very well skilled and well trusted individual. Personally, I have been blessed to be connected to Healthy Start since my eldest child was a baby. He'll be 23 this year. So the Male Initiative program helped me become a solid father and a solid male on this planet. So I have continued some of those efforts, establishing some male groups. I assist with a men's support group at the Kingsley Association. I'm also a part of a group called the Men's Progress Network. It's a nonprofit where we leverage each other's professional skills, and we also provide that therapeutic support to each other. So my success is a little bit more male focused right now, because there are more resources available, not exhaustive for ladies, but there are more resources available for ladies. So being able to put some platforms and some forums in place to where our male counterparts, our male leaders can come in and be healed and love on each other and take that love back into the community is a major success that I can see.
Thank you, Andre. Love to hear that the men are being supported, and I think Mr. Art has so beautifully said many of times, the number one protective factor for women, pregnant women and postpartum, is their partner. And so thank you so much for what you do and taking, your experience and spreading that to others to their benefit. I, with no bias at all, am going to promote MVD, which is the organization that I work for. I think MVD is one of the places that is few mental health places that is doing it right and is at its core focused on our participants. The flexibility that we offer our moms, I think, is the number 2 strength of the program. And it's a need that our moms desperately have. And it's a barrier to mental health support. And so you're not being charged if you miss a session. You're not being reprimanded for X, Y, and Z, for having to reschedule for your kids being sick. We see it, right? We see you, we see your need, and we're meeting it at MVD. And that's why women are completing the program, because we're treating them like mothers, and many times single mothers is the only caretaker of their children, and making sure that they can come to therapy in whatever way that looks like, even if that's over the phone, because you're not comfortable with being on camera, because that's how scary mental health treatment is for some of the women that I work with. It is so scary that even showing your face feels like too much, and MVD takes that into consideration. And I hope, with all of my heart, that more mental health agencies in the Pittsburgh area look at MVD. We are a small program, but we are mighty, and Taylor has put her heart. She is the reason this program exists. Like, let's not get it twisted. Taylor is the reason that this program is around. And I want more people to see her and what she brings to the table as well, because she has beautifully bled that into MVD, and we are thriving. So that's a big success that I see in Allegheny County in terms of mental health for people of color.
I can't remember who I said next, but maybe come
I
on.
believe it was me.
I'm sorry, I'm a little emotional. Okay.
Okay. I think it was me. Yeah. Listen, I'm always I welcome a little emotionality, particularly when we're talking about such a deep and pervasive and emotional topic, right? If nobody moved to tears today, I might have called it a failure. I might not have said it out loud, but I'd have been thinking it anyway. I will say this. This is one of, I want to say, near about a half a dozen sorts of panels I've been asked to participate in just in 2025. And that in and of itself talks to me about the successes, right? Like we talked about destigmatizing, and then that part of destigmatizing is normalizing the conversation. And I think that is evidence that the conversation is becoming normal. One of the other things I've been experiencing in my personal life is I have had a number of African-American male support groups reach out to me to say, like, brother, we could use your energy. And I'm like, oh, wow, I got choices, right? With regards to building a community among my brothers. 5-6 years ago, I probably didn't have that many choices. I had that own portion of my network built, hallelujah, thank you, God, that I did. But to see it happening in formalized ways, and crossing bridges and bringing people to the table together who don't necessarily have a long history of relationship or getting to know each other. And I'll make that my third and final point, to be on this particular panel and see as many familiar faces, such as Andre, such as Thomas, and others, but to see some new faces and some new names, those whom I don't recognize, who are, on the front lines doing this work, is also evidence, as I'm starting to see. Like, I say almost all the time, like, listen, are Black therapists and providers and that sort of thing a little bit rare? Sure we are, but there are more of us out here than you think. And the opportunity to have that evidenced as I'm sitting here today, I think, again, is a measure of the success and change that is happening locally.
I'm just going to echo all the great points that everybody's already mentioned. I think success looks like us being able to come together and connect with, familiar faces and new faces, and also with folks outside of the mental health space. So if they are approached with, an opportunity or an individual who needs support or assistance, or somebody to come and normalize these conversations, they also have built onto their network as well. So again, I think all the points have already been made, and I'm just going to, support and echo everything everybody's already said.
You all are so essential. And I'm truly honored to have had the opportunity to connect with each of you. And I hope that we cross paths again and again and again. And I'm rooting for all the work that you all are doing, and it matters. Thank you so much for being a part of this panel and being in this space, and for allowing us to just continue to talk about the amazing work that we're doing. I'm really, really grateful.
Well, thank you so much, Taylor, because you did an amazing job moderating our provider panelists. I expected nothing less. And thank you to all of our providers, Tamar, Kava, Aki, Andre. You all did your thing. I thank you all so much. This legislative breakfast has been extremely informative, from our legislators to our providers. And I can tell you now, I've been monitoring the YouTube chat, and everyone has been loving it. So at this moment, we are going to take this time to do a little bit of questions and answers. We still have Senator Jay Acosta on, and we still have Rep. Sanchez on, and then all of our providers are still here. So you can send your questions through the chat. I will repeat them, and we'll move on from there. Let's give it a couple seconds.
Mariah, while we're waiting, can I kind of kick this off, please?
Yep.
Okay, I have a question for the providers. I'd like to ask each of you if you could just give me 15, 20 seconds on how important is it to you to show up as your authentic selves in dealing with the clients and the participants that you see on a regular basis that come from the same communities in which you live?
I can start. Wouldn't I be a hypocrite if I showed up as my not authentic self and asked them to show up as their authentic self? So it's mandatory if I want people to shame dive in safe places. And if I'm not my authentic self, I'm not safe, because then I'm not being genuine. And so being genuine is, I think, a beautiful part of the recipe for getting people to open up in mental health services.
I'm going to, piggyback on what Tamara said. We can't show up in these spaces and not be authentic. We're expecting folks to receive us and build rapport with us. So if you show up as anything other than who you are, people are going to be able to pick up on that. They're not going to trust you. And the ultimate goal of having positive outcomes in a therapeutic experience is not going to be achieved.
One of the beautiful things about being an African American in Southwestern Pennsylvania is there is no such thing as 6 degrees of separation for us. All the Black folks know all the other Black folks for the most part. I joke that there may be half a degree of separation. In fact, I found out today that Kava is my cousin. Never met her before, never even heard her name before, and just found out she's my cousin. That being said, it is entirely important to be our genuine and authentic selves. And part of being our genuine and authentic selves means knowing when being our genuine and authentic selves is going to be in the way of service provision. There have been times where, because the degrees of separation aren't great enough, I've had to tell a person it is probably not in either of our best interests that I serve you. And there are times where that person's pain is so reflective of my own and so similar to my own that it is best that I not allow myself to be triggered and therefore to re-trigger them and and get my pain out of the way of their pain. So it's both and. Like, you cannot afford not to be authentic, but you also have to be authentic enough to know when who you are is the problem.
Awesome. Thank you so much. This next question I think may be for you, Aki. So somebody said they thought about that law enforcement, not being involved was so crucial. How do we fix that?
So who here doesn't know a police officer on a personal level? I think every one of us knows someone with someone in our family. At the end of the day, we have to start at home, right? I grew up in church, and we would always say ministry starts at home. Okay, so listen, start with the officers with whom you have direct relationship with. A lot of us probably ended up here not because of a professional connection to a person, but some of us very specifically because we have a personal relationship with another individual. You have to start where it's easiest. Pick the low-hanging fruit first and start to, generate conversations with the people you have close relationship with, in part because that's a safer space. I can't run up, to my local police station and just start asking to have this conversation with folks who do not know me or understand my heart or my intentions. And so at the end of the day, start in those places where you'll be received, because if nothing else, they understand who you are and you understand who they are as a person and not as a position.
Thank you so much. This next question could be, it's good for both providers and the legislators that we still have on. What are one or two key changes at either the system or community level that could immediately improve mental health outcomes for Black families?
Well, I will start. I think it's resources to support programs like County Executive Innamorato has started. I think that's critically important. We don't have the resources for the programming that we have right now. We're not going to have any impact or anywhere near the degree of the impact we'd like to have. So I think it's a function of resources and commitment and will to be able to provide the resources through government, essentially, and our foundation community and other providers who are in that position to do that. I think that's going to be the best way to achieve it. But having program based that we now have, I think, that have been developed the last 15 months in Allegheny County with the county executives work, and then having resources to support it from various sources.
Thank you. Alrighty, we have another one in the chat. How can you build a consortium or network of mental health services throughout the Black community, particularly and especially with men?
From my experience, make it as informal yet intentional as possible. When we have our male groups, it's a gathering of sorts, and we have an agenda, but it's free flowing, if you will. And if the energy in the room and the spirit of the room takes it elsewhere, then we allow that to guide our discussion and guide our interaction. So it's not so, I'm not speaking for all males because that's like rude to do, but we don't really like being controlled and told what to do. So if we can be offered that space and then allow us to manifest what's necessary in it, it'll help with that dynamic.
I'll piggyback off what Andre shared, and thank you, Andre, and thank you for the question. With regards to unity, and while that I don't think was necessarily worded in the question, I do think that's an important aspect of what we're talking about. I think we need to understand how unity begins. It's organic. And when unity is sought after in an inorganic fashion, it rarely lasts. It really germinates and grows. Unity happens by accident. One of the things I talk about with some of my clients is something that exists in the Black community that we call the nod. I teach people about communication, and I teach people about how men and women communicate differently, and how in the Black community, because eye contact can mean confrontation, conflict, or combat, we developed a system. That's how we make sure we check in with each other. Guess how that started? We didn't write a paper. We didn't call a meeting. It just organically happened. I don't recall anyone ever teaching me. Daddy didn't sit down and tell me, now, son, when you and some man make eye contact, make sure you give him one of these. It just organically became something I understood, and it became a point of unity within our community, right? And so just using that as an example, does that fully answer the question? No, it does not. But I think at the end of the day, we have to be specific and understanding that, to Andre's point, bringing the thought leaders, bringing the practitioners, the stakeholders to the table in an organic fashion, in an informalized way, I think will lead to some of the sorts of formalized consortiums, et cetera, that you're looking for.
Thank you. And we're going to take just one more question. And I think this question is very important, especially to our legislators. How do you plan to include community voices in mental health policy decisions?
I'm not sure if any legislators are left, but I'll tackle it. I think by having engagements like this, speaking in in community groups around the region, which we do often, communicating, having our staff communicate with folks as well, soliciting conversations through, for example, telephone town halls that I do frequently, engage with folks in terms of what some of the priority items that they want to talk about. But hearing from folks and learning more about it by having folks participate in various programs around the region, whether it be me personally or our staff folks. That's typically how we engage in that. And then we also read about it. We read about some of the different things, and then we learn from my colleagues. We learn from each other about what's taking place, not only in Pittsburgh, for example, but around the state, and other programs and policies that they have in place in different counties and the like. So it's a variety of ways in which we glean and develop that information that we have.
Thank you for that. And I appreciate everyone who sent in questions in the chat. We weren't able to get to all of them, but they were all amazing questions. And at this time, I would love to hand it over to our CEO, Jada Sherrill.
Thank you, Mariah. Good morning, everyone. What an amazing discussion this has been over the last 2 hours. Thank you for the expert facilitation. Thank you to our wonderful Healthy Start team, our consortium for planning this for the 5th year in a row. Our policymakers, our mental health panelists, our Healthy Start staff, if I didn't say that, our testimonials, and of course, our viewing audience community. Each year, I like to come back to one thing that really stood out to me, and it's hard to pinpoint one thing because there have been some really phenomenal insights shared here today. But the gut check for me was the fact that Medicaid funding covers 1/3 of our births in Allegheny County and covers just about all of our mental health services. So we must protect Medicaid funding. If you didn't know those facts, now you know. The presence of Medicaid funding impacts, affects, and benefits us all. We cannot afford to jeopardize Medicaid funding as a community. We are fortunate in Allegheny County that we have leadership that understands and prioritizes the needs of our families and our communities. We are fortunate for so many passionate service providers that are dedicated to their craft, to their work, to mental health supports, to working in community and to supporting our Black families. But we also know that there are many bureaucratic and systemic challenges that counter and threaten that work. For the sake of time, I want to point out a couple of advocacy actions that Healthy Start is promoting, that we want you to understand the importance of taking action. Moving from a discussion, we've had a great discussion. We've heard personal stories. We've heard from our legislators what the priorities are in terms of their work and representing their communities. But we want to help you to understand that as residents, as constituents, we are voters, and we need to talk to our elected officials and make sure they understand what we need in our communities. So we have a slide that has a QR code where you can easily and effectively communicate with your legislators. For the sake of time, you can go ahead and take a picture right now, or you can screenshot it and do it later, but I ask that you do it today. So there are three very important things that we are focused on. One is protecting Healthy Start funding. So the Healthy Start program funding stream is federal funding. It is a small portion of the funding that we receive as an organization, but the Healthy Start Initiative is a national initiative that prioritizes maternal and child health. That includes mothers, fathers, all birthing people, babies, and it includes a focus on mental health for perinatal people. And we know that in Allegheny County, we are doing work to look at how do we also focus on dad's mental health as a predictor of the success of the family. So please, please let our policymakers know that funding for the Healthy Start Initiative is imperative. The second is protecting Medicaid funding. Again, we've talked about the importance, the universal importance of Medicaid funding. And lastly, Family Medical Leave Act. Paid leave for caregivers is imperative. It is not just for people who have had a baby. Some of us have had experiences needing to care for other people in our families, parents, other family members, and having to navigate your livelihood and having to possibly lose your livelihood because you need to be in the space of a caregiver is unacceptable. Lastly, I just want to continue to underscore the importance of us taking action and us continuing this dialogue. We do have a mental health roundtable that is part of our birth initiative. That's the Allegheny County Birth Initiative for Black Families and Babies, and BIRTH is an acronym for Battling Inequities and Realizing Transformational Health Outcomes. You can learn more about our birth initiative on the Healthy Start website, www.healthystartpittsburgh.org. Our mental health roundtable is being held on the 26th at the Pitt Community Engagement Center in the Hill District. And if you would like more information on that, you can reach out to Yasmin Bennett Kelly on our team. Her email is ybkelly@hsipgh.org. We'll also put it in the chat. Again, thank you so much for being a part of this dialogue. This needs to be a continued dialogue moving toward action. We've heard some of your questions and where you think Healthy Start can continue to support in this work. And we are honored to continue this work alongside you. At this point, I want to turn it over to Mrs. Thelma Jackson, our Senior Program Manager, to close us out. Thank you.
Well, thank you so much.
Thelma, you're on mute. Yeah, you've been on mute almost the whole time, dear.
On mute the whole time.
Just
Is
about.
that the joke of this session? Okay, sorry. What? Thank you all so much for participating in our 5th annual legislative breakfast. I am the Community Consortium Coordinator, and it is my job to tell you a little bit about what the consortium does. It is a multi-sector partner with partners who volunteer to advise and inform the activities and direction of Healthy Start to help improve perinatal outcomes within Allegheny County. If there's something that you've heard and you would like to participate with us, we meet 6 times a year for 1 to 2 hours every other month. So that's not a whole lot to put in for. So all I ask you to do is contact me at tjackson@hsipgh.org or 412-915-0682. Thank you all. We could not have done this without you all, especially our legislators and our providers. The conversation was wonderful. It was wonderful. And Aki, we will address the police situation shortly. So thank you again. And listen, it's all good, y'all. What an excellent presentation we had today. Thank you. Wonderful, wonderful. All right.